And so one of the first things I want to do is to actually give a definition of what infertility is. We define infertility as being the inability to get pregnant, to conceive, after about a year of unprotected intercourse. And that's for women who are less than 35 years old. After 35, we define it as being 6 months of unprotected intercourse without the ability to achieve a live birth. When I'm seeing couples for the first time, one of the things that they ask me is, why is this happening? And what is the most common reasons for it? And what I tell people is that a third of the time it is due to a female-related factor, meaning that the woman does not release an egg on a regular basis, or there's some sort of abnormality in the fallopian tubes or the uterus. Another third of the time it's related to the man, meaning that there's an abnormal semen analysis, there's not enough sperm, they're not of normal shape and quality, or there may be some issue in terms of erectile dysfunction or the man's ability to ejaculate. And then a third of the time it's a combination of the two. Now, if we talk about what it takes to do an evaluation of a couple, this can actually happen very quickly. For example, we can determine whether a woman is ovulating usually by simply talking to her and finding out whether she has a regular period, premenstrual symptoms, and that sort of thing. To find out if there's an abnormality with the fallopian tubes or the uterus, there's a simple test called a hysterosalpingogram, and it gives us a huge amount of information about whether the tubes are open and the uterus is of normal shape. Evaluating the man is also very simple. We can do a semen analysis, and also by talking to the man we find out if there's any suggestion of any sort of sexual dysfunction. As women get older, there's another aspect or factor that comes into play, and that is age-related changes. At about 20 years old, a woman's chance of getting pregnant every month, if she's completely healthy and her partner is healthy, is about 30%. At 30 years old, it's about 20%, and at 40 years old, it's about 10%. And that's why we give couples a fair amount of time to try to get pregnant on their own. One of the other things that I like to talk about with my patients when we're looking at reasons for infertility is to keep an eye out for symptoms and signs of endometriosis. Endometriosis is a surprisingly common condition in women, and the most common symptoms related to it are painful periods, pain with intercourse, and, in some women, infertility. At Obgyn West, we pride ourselves in treating our patients as individuals. We try to instill a realistic expectation of hope because in most situations there is a lot of reason for hope. There's virtually nothing we cannot work around in terms of helping a couple get pregnant.